many of you have been told you need to hurry up and have children before your clock runs out? That phrase is usually told to women when they're getting older in the effort that they're too old to have a baby. Some time ago, a mother who would give birth in her late 30s was likely to be having her last or next to last child. In current times, many women postpone motherhood for various reasons. A couple of those reasons are their career. They begin out their career and they pursue that to really get established in their career and push off having children until later in life. Or sometimes women even wait till later in life to get married. Therefore, the motherhood becomes later in life as well. Pregnancy that occurs when the maternal age is 35 years or older is characteristic of 3 serious risks. Based on my research, I've found and will show information that is critical to the health of both the mother and the child when the maternal age is 35 years or older. Pregnancy at or after the age of 35 is found to bring health risks for the mother, as well as genetic disorders for the baby, birth defects for the baby, and sometimes even death for the baby. During the next few minutes, I will explain risks such as hypertension, diabetes, Down syndrome, and death. The overall health of the mother before the pregnancy can predict the level of intensity that the mother experiences concerning health issues. It is important to be healthy before and during the pregnancy. The most common risk in delayed pregnancy is hypertension and diabetes for the mother. The Harvard's Women's Health Watch has proven that the presence of hypertension and diabetes before the pregnancy plays a role in the overall health, but the risks do not have to be present before the pregnancy to develop during the pregnancy. Children born to mothers at the age of 35 stand a chance of being born with a genetic disorder such as Down syndrome. The most common factor for pregnancies resulting in Down syndrome is the maternal age. As the mother gets older, her chances for having a pregnancy with chromosomal abnormalities increase. The National Institute of Child Health and Human Development lists this graph on their website. As you can see, a mother at the age of 30 has a 1 in 900 chance of having a baby with Down syndrome. But as you go up in age, the chances get even greater. A 37-year-old mother has the chances 1 in 230 of having a baby with Down syndrome. And if you look on over here at the age of 40, it's a 1 in 105 chance of a baby being born with Down syndrome. The National Institute of Child Health and Development recommends that mothers ages 35 and up go for a prenatal testing for the possibility of Down syndrome. Parents who have a child born with Down syndrome are likely to have further children who are also born with Down syndrome. Women over the age of 35 face an increased chance of chromosomal abnormalities that often result in a miscarriage, which is termination of the pregnancy. Abnormal chromosomes play an effective role in the occurrence of miscarriages among women ages 35 and up. The American Journal of Reproductive Immunology found that reoccurring miscarriages result in the mother and father terminating their chances or their aspiration to have further children. The American Pregnancy Association reports that women 35 to 40 have a 20 to 35% chance of miscarriage. One can see that pregnancy after the age of 35 does include risks to both the mother and the child. In delaying motherhood and childbirth, one can see that there are health risks and concerns to consider. Risks faced during the pregnancy and after birth are health problems for the mother, birth defects for the child, and possible termination of the pregnancy resulting in death of the child. Mothers who postpone motherhood to a later time in life should be aware that there are risks to be considered, both pertaining to the mother and the wellness of the child. Thank you for your time.